All right, good morning, everyone. Welcome to the THSADA Region 8 webinar. My name is Bob DeYoung. I'm the THSADA Assistant Executive Director. It's my pleasure to be here today. I want to welcome all of our esteemed panelists and also those of you who are entering the chat room as an attendee. If everyone will go ahead and sign in the chat area, that way we can keep a record of who was able to view this live. Just for discussion, we will record this meeting today and make it available to all of our membership in addition to the Region 8 group down in San Antonio. So without further ado, I'll introduce our Region 8 Director, Melanie Hinson. Melanie, take it over.
Thank you, Bob. Good morning, everybody, and thank you for being here. I know that it's been a pretty stressful time for everyone, especially starting school. So hopefully we can be able to share some information today, not necessarily have answers, but share information, and we're all going to get through this together, I know. So to start off our day, I want to welcome Todd Johnson from FCA with our devotional.
Thanks, Melanie. You must have looked at my script. We're going to get through this together, okay? And that's the only way to get through it. I don't know if God won't give you more than you can handle, but that's not true. Sometimes you are given more than you can handle. That's just part of life sometimes, and the only way to make it through is with other people walking alongside of you. And so for me personally, I've had to watch myself sometimes getting lost in all the details. Not the idiom, can't see the forest because of all the trees. And so I'm sure this meeting today, you're going to have a lot of details. What I'd like to do is hopefully bring you back to center of like why you're doing what you're doing. Because when you lose the focus of the big picture, it's really easy to get discouraged and frustrated. And the same goes true for those that you're leading as well. So I've been camping out in the book, in the Bible, in the book of Exodus. There's a lot of great leadership stories and principles. And so that's where I'm heading today. Exodus chapter 17. It's Moses, and God's allowed them to be out of bondage for 430 years. He's leading a group of former slaves into God's promised them a land that he's given them. And but they don't get there automatically. They don't get there right away. And what they encounter in this chapter is they get attacked from the rear, from the backside, by relatives, their own blood in a sense. And sometimes the people that you think you can trust, well, they're attacked from the backside, and the women, the children, and those that are sick, they get hit. And so just like you and I have got blindsided many times in the last 5 months, you have to have a plan. And so Moses, what he does is like he tells his army general, his name is Joshua. It's the first time that he's ever mentioned in the Bible. And he's like, here's the plan. Here's what we're doing. He said, I want you to choose some men, and tomorrow I want you to go down and invite this other group that's messing with us. And then tomorrow, what I'm going to do, I'm going to go up on top of the mountain. I'm going to look down, and God's given me this staff. He's used this staff before to help us to find victory. And I'm going to raise it up. I'm going to raise it up so you can see me and realize that our power and our strength is not because we're great fighters, because we haven't been prepared for what we're about to jump into, but we're looking to a higher power. We're looking to God to give us victory. And so that's what they did. So the next day they're going into battle. Everything is going according to plan. Joshua's fighting. He's doing what he's instructed. Moses is holding the staff up. But honestly, when you're holding the staff up that day, I don't know if you've ever done that or even thought about it, but Moses' arms got tired. And when Moses got tired, his arms started dropping. And when his arms started dropping, the other army started winning the war. And so what Moses did have, though, was he had his brother-in-law and his brother next to him, and they propped him up. They lifted his arms up so he could keep his hands up. And when they did that for the rest of the day, they eventually got victory. You and I have a lot on our plates. There are a lot of details. There is nothing greater than, in my opinion, of this gathering here, because you get to prop up one another Lord willing, you're getting some encouragement, you're getting some guidance, you're getting some direction. And not only should you receive that encouragement today, but you need to find that with your own campus, and you need to be able to be that type of person that Moses had to help lift his arms up on your own campuses in your school district. And so as a result, several things that really drew, that came to me is there's going to be victory. But like Melanie said, we got to be in this together, because that's where the victory comes from. This is going to cause greater unity among you all, and that's a good thing. You're going to be rich, you're going to be stronger, and you're going to be battle tested. And what's going to happen as a result, there's going to be other leaders that are prepared in the process. Nobody asked for this. Nobody would choose to go through this again, but there's going to be a lot of people in your districts that are going to rise to the occasion that one day are going to be replacing you on this call. And so when you look at the bigger picture, instead of all the details, we got to do this, where the soccer refs at, why they not getting back with us, when you keep that big picture focus, you're going to come through this stronger. Not easy, it's hard work, but you will make it through it. And I don't know the timing, but you're going to make it, okay? And so you make it when you stick together and you're unified. So that's the word that God's put on my heart today. And I'm just going to pray that for greater unity, because that's what we need, greater clarity, and just God to give us vision that maybe we haven't seen things, from his perspective or from someone else's perspective, okay? So I'm going to pray, and then I'll let y'all continue. Dear God, thank you for all these men and women that are on this Zoom call today. They have a lot of responsibility, and their decisions and choices impact their thousands of lives. And so, Lord, I pray that you would guide them, direct them. I pray that their gaze would be heavenward. I pray you put like-minded people, not just on this call, but around them, even in their families' lives, to lift them up, to encourage them, to remind them of why they're doing what they're doing, the big picture. Lord, bless their time. See us through this. Remove the coronavirus. Lord, I pray for teams and coaches in these schools to get back to the way that they should be. And we ask these things in Jesus' name. Amen.
Thank you, Todd. Appreciate you joining us today. Have a great day. So next up, we're gonna, we were supposed to have a presentation from Dr. Elza and Brian Polk, but they got called to another meeting. So we're gonna move over to our state sponsor, Matt Faulkner from the NFHS Network. And Matt, thank you for being a state sponsor of the ADs Association. We appreciate you. And so you're on.
Yeah, thank you. I was on mute there. Appreciate it, Melanie and Bob, for having me on for this region meeting. I've been doing this for Houston and Dallas area, and glad to get back in front of you guys. I know since the last time I was down in San Antonio, I think in February, a lot has changed here. So I'm just going to go over our platform once again, as I feel it rings more relevant probably now than it did when I was down there in person with you, with the UIL limiting fans and games. And we have a great solution that won't cost your school really anything to be able to live stream all your events here. So once again, our company, headquartered out of Atlanta, is Play on Sports, and the live streaming platform that we provide is the NFHS Network. So that's kind of like Netflix for high school sports. As of right now, we have over 5,000 schools with everything we're doing. We're adding on about over 500 a week right now. So it's very busy, but definitely a critical time for schools to look at being able to provide their sports to their fans and viewers that might not be able to make it to the games this year. So as you guys know, partnered with the UIL with doing all their postseason events. And now obviously what we want to be able to do is give you the ability to live stream and produce all of your events, whether that's, a freshman game or a pep rally, anything you guys want to be able to live stream, we can do that for you guys. And again, won't cost you anything. So what we came out with here last month is we're calling our high school support plan. So these used to be $5,000 a piece plus installation. We are giving every school in the country 2 free Pixel cameras at free, no cost, no strings attached. The only cost that your school ever incurs is the installation for us to come out there and professionally install your cameras, just to make sure that these free units are up and running properly. So we've built out a couple other things, and I won't touch on that. I'll let y'all follow up and ask questions here later after this presentation if you want to get in touch. But again, it's the installation cost is going to be $2,500 for both units. And so that's the only cost you guys ever incur, zero year-over-year cost for you. So, and from the subscriptions that we get from viewers, we also do a revenue share. All schools are going to be taking part in that for this year and just for the foreseeable future due to COVID. So for every $70 annual pass, the school gets $20, $35, and $45, depending on the number of passes sold. Here's a little table here that you can, make some sense there. So if you were to sell 400 annual passes, if you're a 5-6A school, that's $18,000 that we're revenue sharing with you over the course of a year. Our manual production, this is how we began as a company, actually, before Pixelot and automated cameras were even a thing. So this is a great option if you guys have a put on a Friday night TriCaster multi-angle broadcast. You can absolutely still do that. Use your Pixelot cameras for all other events. Use a manual production for away games or anything else you want to. You stream it just like you do on YouTube. So now the Pixelot cameras, this is where it's really going to come in handy for schools. So they're 100% automated. It looks like someone's behind it, panning and zooming, following the action. It's all AI enabled. We get your schedule on the front end, so the cameras even turn on and off automatically because they know what team and time and venues these games are taking place. We integrate your scoreboard here at the bottom, so you have that little score bug with down and distance, clock, teams, all that information fully automated down at the bottom. And then we can integrate in with any coaching software. So if y'all use Huddle, use this for any event, so live streaming games or a private practice recording, you get automatically emailed an MP4 video file sent to you, so you can take that file and either upload it into Huddle, coaching software, make highlights, share it, whatever you want to do. So, and as well, you can also live stream non-sporting events, which are free for any viewer. So pep rallies, graduations, signing days, anything you guys want to do, you can manually schedule those to be live streamed. So you see here the cameras. What we do is we're going to mount them on the side wall there, and then connect it back to the video processing unit where all the software lives and gets updated. This is the only thing that needs to be plugged into hardline power and internet, so you don't need to run it up to here, up to the camera location. And then on the right, it's just an overview of how we integrate in your scoreboard automatically there. And if you guys don't have hardline press or a hardline internet in your press box, we'll include now a free point-to-point wireless bridge for you guys built into that installation cost. So if you need that, just let us know and we can get that hardline signal out to you guys. Advertising, just another way you guys can make revenue. School keeps 100% of all advertising that you do. We just give you this opportunity to upload company logos or have a pre-roll YouTube type of ad video play when people log in. And again, this money never touches our hands. You guys keep 100% and set the cost and collect it and everything like that. You can also use it for practices. So we have a practice app that you can manually control the camera down on the field. Again, those are set to private, so no one can log in and watch it, but you just get that video file afterwards. So that's pretty much it. As of right now, we are about 4 weeks out from the time we get the green light to getting these installed and up and running for you guys. So I'll put my information in the chat. So with my email and cell phone number, the best way to reach me, honestly, is through text or emails. My phone rings nonstop right now. And so again, I'll put that up there and let me know if you guys are interested. And if your whole district wanted to come on, we can definitely we can get that installation cost down quite a bit as well, and eat some, if not all of that, if a whole district comes on board. So, all right. Thank you, Melanie and Bob.
Thank you, Matt. Again, thank you for supporting our association. Are there any questions for Matt? I don't see anything in the chat. Okay, Bob, will you share Matt's contact information in case anyone has questions to get in touch with them?
Sure, I'll be happy to.
Thank you. Okay, so again, just to kind of go over the agenda, Dr. Elza and Brian Polk couldn't be here today. Last week, Region 20 did a couple of Zoom meetings covering contact tracing and return to play protocols. I think it's really good information that we need to get out, and especially the return to play protocols for our kids and implications for our athletes. That's the athletic trainer in me talking. Just get that information out to you. So Dr. Anita Kurian from San Antonio Metro Health Department has joined us today to give us a brief presentation on contact tracing, hopefully clearing up a little bit of the questions people have. So Dr. Kurian, thank you for being here. It's yours.
Thank you. Can you guys hear me well?
Yes.
Okay. Okay, there you go. Good morning, everyone. Thanks, Melanie, once again for the invitation. And I'm really glad to be here to give you all a brief overview, like Melanie said, of the contact tracing process and how we at Metro Health use this contact tracing to address this once in 100-year pandemic. So what you see up here is the public health investigation components. The goal of all public health investigations is always to find the disease, stop the further spread of the disease, and prevent from new cases of the disease, prevent the new cases of the disease occurring. And so this find, stop, prevent is usually done using these three components of the public health investigation that you see on this slide. So the first component is the information gathering from the case, which we also refer to as case investigation. This leads from the case investigation, we get information on contacts. So we have information on identifying who these contacts are of these cases and informing these contacts of their exposure. And the last step of our investigation is monitoring and providing support to these contacts to ensure that they don't end up contracting this infection. So for all practical purposes, this identification of contacts following the case investigation and informing these contacts of their exposure is what we commonly refer to as contact tracing. So what is case investigation? Before I go into contact tracing, briefly, case investigation is the identification and investigation of patients with confirmed or probable diagnosis of COVID-19. So I'm going to focus my presentation mainly on, strictly to COVID-19, but this is the principle we use for any infectious diseases. So case investigation entails collecting a collection of critical information about a person who's diagnosed with COVID-19, gaining insight regarding the patient's knowledge of COVID-19, and then providing disease-specific information and guidance for how to manage the symptoms. So we start this process by verifying the patient's demographics, locating information, which is addresses, telephone numbers. Then we follow it up by an assessment of COVID-19 symptoms, onset and duration of symptoms in order to develop a baseline for medical monitoring and contact elicitation window, which is important for us. And we also collect information on the underlying health condition of the patient that may have, that the patients may have, which may place them at a higher risk for complications or severe illnesses, including any information they might have on any hospitalizations that they might have had. And most importantly, during this case investigations, like I mentioned earlier, we work with the patient who has COVID-19 to help them recall everyone they have come in close contact with during the time when they may have been infectious. And this is important, and you'll see what an infectious period is in the next slide. And we obtain the names and the locations of these close contacts who may have been exposed to this patient while the patient was infectious, and then attempt to reach out to all these contacts who've been identified. So the next step of that public health investigation is contact tracing, which is the meat of this presentation today. So contact tracing in general, it's a core disease control measure, which is employed, like I mentioned, by all public health departments for decades to slow or stop the spread of the infectious diseases. So it's not surprising that contact tracing is the key strategy for controlling and preventing for the spread of COVID-19 as well. So contact tracing is, following the case investigation, is a subsequent identification, monitoring, and support of cases' close contacts who have been exposed and possibly infected with this virus. So once identified, the contacts will be informed, assessed for their symptoms. They will be provided resources for quarantine and support and education, and link them to testing when it's necessary. So who is the close contact? So close contact, the definition of close contact is constantly evolving with our understanding of COVID-19. At this time, close contact is defined as somebody who's directly exposed to infectious secretions, including being coughed on by a case, or somebody who's within 6 feet for a cumulative duration of 15 minutes. Oh, that got cut off. So it's being within 6 feet for a cumulative duration of 15 minutes. That's important. And if either of these should occur during the infectious period of a case in order for a person to be identified as a close contact. So what is the infectious period? I keep referring to this in all the previous slides. So infectious period typically refers to the time when you're able to spread the virus to someone. So for symptomatic cases, these are folks who have symptoms and have tested positive for COVID-19. Symptomatic cases are infectious 2 days prior to their symptom onset to up to 10 days after symptom onset. And again, okay. For asymptomatic cases, these are individuals who don't have symptoms but have tested positive for COVID-19. So for asymptomatic individuals, the period of infectiousness is 2 days prior to their test onset and continues for up to 10 days following their lab test confirmation. So other considerations that we take into account, in addition to having come in contact with direct infectious secretions from the case, or being in close contact within 6 feet for a cumulative period of time, time frame of 15 minutes. Some of the other things we also take into account to determine if a person or a student is a close contact are these items that are listed up there. So mask use, we need to determine if both the infectious individual and the potential close contact have been consistently and properly masked. If yes, then we don't consider that person to be a close contact, or don't consider that to be a significant exposure. Now, other considerations are there physical barriers? Are there plexiglass barriers? Are there dividers? Are there sneeze guards in place? Or are there other forms of partitions in place that prevent the spread of these droplets when the infectious person is coughing, and that could land on somebody who's close by. Was there adequate ventilation with circulation of outdoor air? Did the exposure happen indoors or outdoors? Typically, if it is outdoors, again, we take the whole picture into consideration before we deem an outdoor exposure as no exposure. But typically, the transmission tends to be significantly lower if it's an outdoor open air exposure where people tend to have more space to be socially distanced. So we hear these words, and I'm sure everybody's heard these words, the isolation and quarantine. And in my world, in the public health world, these are two completely different terms, but they're commonly, I see them being often used interchangeably, but they're two very distinct concepts. Quarantine, as you can see up there, quarantine separates and restricts the movements of people who are exposed to a contagious disease to see if they become sick. So in case of COVID-19, your close contacts are the ones who would be quarantined. Now, isolation, on the other hand, is the process of separating sick people. These are people who are already exhibiting symptoms, sick people with a contagious disease, from people who are not sick yet. And this is done to ensure that the people who are not sick yet don't contract the infection and become symptomatic. So isolation separates sick people, and it keeps from someone who is sick or tested for COVID-19 without symptoms away from others, even in their, and this is typically can be done, if it is mild illness, can be done in their own homes. So who does quarantine affect? So quarantine affects typically only those who are in close contact with a positive individual. For example, if Johnny is a close contact, he will be quarantined. Close contact of a close case, Johnny will be quarantined. But if Johnny's brother, Stephen, who did not come in close contact with this case that Johnny had come in contact with, then Stephen would not be recommended to be quarantined or excluded from the school or the public setting. And we also caution the family members to make sure that students or family members who are recommended quarantine are maintain a safe distance from other family members in their own household, and also monitor for their own symptoms. So the next few slides we'll be talking about return to school policies. So somebody who's identified as a close contact, they can return to school 14 days after their last date of exposure to a case that was identified. That's very important. It is 14 days, not from the time that public health deems that person to be a close contact. It is 14 days from the last date of exposure of that student or a person to a particular case. Any individual who tested positive and were symptomatic, meaning they have symptoms compatible with COVID-19, they cannot return to campus until these three conditions listed here are met. The first one is at least 10 days have passed since the symptom onset. The second is at least 24 hours. At least they have 1 day with no fever, without fever reducing medication, and the individual is showing improvement in symptoms, especially symptoms like cough, shortness of breath. You will never find resolution of symptoms. The resolution of all these symptoms completely will take longer. So what public health is looking for is any improvement, and with the evidence we have at this time, we believe symptoms of improvement and 10 days passing since the onset of illness and being fever-free for 24 hours will deem that person non-infectious, meaning the person will no longer be able to transmit that illness to others, and hence can return back to school. For individuals who tested positive but never developed symptoms, those are your asymptomatic individuals, they can return to the campus 10 days after the date of their first positive test. And as far as those individuals where no testing was done, so if in case of an individual who has symptoms that are compatible with COVID-19, but was never evaluated by a medical professional or tested for COVID-19, such individual, we assume them to have COVID-19. And those individuals may not return to campus until the individual has completed the same 3 criteria that was there on the last slide for the symptomatic positive test individuals, which is 10 days should have passed, 24 hours fever-free without taking any fever-reducing medication, and there is symptom improvement. And if that individual wants to return to school before completing the required stay-at-home period, then we ask that the individual must either obtain a medical professional's note clearing the individual for a return based on an alternative diagnosis, or have a negative test for COVID-19. Keep in mind, if this individual is identified as a close contact, then the individual will still be placed in quarantine for 14 days, even if the test comes back negative. So the roles and responsibilities that you see out there, we've always worked very closely with the school nurses on infectious diseases. So some of these things are laid out here are already in place. School nurses are very aware of what their roles are, what our roles are. We work closely throughout the year pre-COVID era. TB is one important infectious disease. We work closely with the schools. Measles, flu. So this is not new for the school nurses. So what you see up there, school's responsibility for COVID-19 is to report weekly aggregate number of cases that you see among students, among staff, and we have a reporting form that's already been emailed out to the school nurses. And any positive case. In addition to those weekly reports, we also require, it's required by the reporting law in the state of Texas that anytime a school nurse or a school official become aware of a positive case of COVID-19, that is required by state law to be reported to the Metro Health Public Health Department as soon as possible, immediately. And then gathering information, school nurses work closely with us to help us gather the information with regards to contact tracing within the schools. And health department's role is, again, provide any kind of support that the school nurses might need. We do a lot of work in regards to risk communication. We assist with, drafting letters to parents, teachers, students, whatever the case may be. We do provide all those supports to the school nurses year round. So for reporting a positive case, these are the reporting items that we require of the school nurses or the school officials, what you see up there, all the demographic information, the contact information. And again, this is not unique to COVID-19 cases. We require the same information for any other infectious diseases in school to initiate and complete our investigation as well as our risk assessments. So what information are needed for the close contacts? Again, pretty similar to what we need for the cases. We will need the demographic information and the address for the close contacts so we can reach out to these close contacts and put in the public health measures in place that's needed. The options for sharing, data sharing, again, we've shared this with the school nurses as well. There are, we are exploring the best options at this time. We have a fax option, we have a secure email options. Again, we ask that this information be shared with us in a secure manner because these are HIPAA information. A general email is not HIPAA compliant. And there is a SharePoint that you can share this information with, which is HIPAA compliant too. And so for SharePoints, I've been asking schools to identify points of contact so we can give these contacts access to the SharePoint. So if any one of you need access to the SharePoint that Metro Health has to share information regarding cases or contacts within your school, please reach out. I have my contact information at the end of the slide, and we will make sure you get access to this SharePoint so you can safely and securely report this information to us. These are some of the checklists, some of the resources, and I'm going to end with putting all these resources up. Checklists for coaches, very important to go through to make sure that you and your players are kept safe. And here are some of the resources, and I think I will end it here. So I want to end by saying, this COVID-19, like I mentioned earlier, this is a once in a year pandemic. We are in this together. We are in this together for a long haul. At least I don't envision this going away. We need to learn to live with this virus. We will all have to make adjustments to our regular life. This is a long haul. I can't emphasize how important this is. So until we have a COVID vaccine, an effective, safe COVID vaccine, we need to keep doing the things that we've been doing so far. We know these works. These are simple things. Stay home when you're sick. Practice social distancing. Use face covering consistently. And again, practice good hand hygiene. So I'll stop here. Thanks again thanks again for inviting me. Thank you for your time. And I will stop here and take any questions if I have.
Dr. Kurian, a lot of the people on this meeting are asking if you'll share your presentation.
Absolutely. I will
And
send
I
it to
can
you.
email it out to our region. Are there any more questions from anyone?
Dr. Kurian, this is Dr. Lopez. Could you comment briefly for the athletic directors on what you think they should do for reporting close contacts, for example, in the setting of football that's getting ready to get started? These teams can be quite large, well over 40 people, and we know it's going to be a challenge when we do have an athlete come down with a positive test, and UIL guidelines obviously require reporting to Metro Health. That can be quite extensive in the amount of data they need to collect for you.
Yeah, so that's a difficult question. And that's one of the sports that requires physical closeness of the players too, and the closeness may be for a prolonged duration of time that we don't recommend, right? It could be beyond 15 minutes. So I think what we say at this time is when that happens, keep those games to minimum if possible. I'm not sure if that's completely possible, but whenever it's a general thing is make sure before your players come onto the field that they are not symptomatic, they don't have any symptoms. If there is any sharing of equipments, sure, even in the locker rooms, make sure those are clean in between use. In the locker rooms, see if the players can practice social distancing. And then everybody else on the field, obviously when the players are running and tackling each other, I don't think use of mask would be feasible. So we say, everybody around them, staff and players around them sitting on the stands, practice those measures. But again, there is no one solution to this. This is not an easy question to answer. But all I would recommend the coaches is, keep a close eye on these players and monitor them for they should be monitoring themselves for symptoms anyway, and any sign of symptoms, exclude them immediately.
Dr. Kurian, we have a question. Can you clarify and give examples of what cumulative for 15 minutes means in the close contact definition?
So this comes up often. It's not 15 minutes of exposure one time. It is 15 minutes of exposure during the course of one day. So if these people are in close contact during lunchtime for 10 minutes, so that 10 minutes, and then they go back to using restrooms and they're in close contact, or standing in a line at close contacts without the use of face mask for 5 minutes, then 10 plus 5 will add up as 15. So we're not looking at one 15-minute exposure. It's several, short minutes, a short duration of exposures adding up to 15 minutes during the course of a day.
Thank you. The next question we have says, we have had questions about the phrasing of exposure to bodily secretions. Is sweat a secretion that would be considered close contact?
So, no, what secretions we are looking at, remember COVID-19 primarily spreads through droplets. So when an infected person coughs, sneezes, any secretions from their upper or lower respiratory tract is what I refer to. And again, there is no, that is one of the options of transmission, but the primary driver is still coming in close contact with somebody who's sneezing directly onto you. These indirect exposures can happen. We don't know that we don't know that for sure at this time, but this is taking every precaution to make sure that we don't come in contact with any secretions. But the secretions when I refer to is the direct contact of secretions when I refer to in my slides. Those are primarily your respiratory secretions.
Thank you. Do we have any more questions?
Yeah, I've got one.
Okay.
In regards to the close contact with the mask on, and we're accumulating 15 minutes. If both of them have a mask on, does that time count or not count?
No, so this is the TEA and even Metro Health. Ideally we recommend you be socially distanced 6 feet with mask on. But if 6 feet social distancing doesn't happen, but both the case and the other person is masked, then we don't consider that to be an exposure. But again, please contact us. These things are case by case basis. We need to know how consistent they were in using their mask, how well it was fitted to them. What's the type of exposures too? Did they cough directly onto the other face, even with a mask on? So generally speaking, if both the case and the contact have a mask on, we don't consider that as an exposure. But like I said, contact us and we will determine that on case by case basis, should you encounter in a situation.
Thank you. Anyone else? Okay, Dr. Carrion, I appreciate your time again. Thank you for joining us. I will get her presentation and share it with the group. And so there's no more questions. We're gonna move over to Dr. Lopez from Sports Medicine Associates to talk about return to play protocols. Dr. Lopez, it's yours.
Great, thanks for having me. I appreciate Dr. Kurian joining us this morning as well. That contact tracing is going to be a big part of the challenge we're going to face getting back into high school and middle school sports over the next couple of weeks and a few months. So I'm going to go into some of the details that she was referring to, but knowing that Metro Health is going to require a report from all of you, you may already have a database of your athletes with all that required info. But if you don't, probably a good idea to start compiling one in the event that you do have to report close contacts to Metro Health if we encounter that situation with a positive athlete. The cumulative time frame has also been a big challenge for us. I'm sure all of you are thinking about football. These people are lined up across from each other for 30 seconds at a time over the course of an entire game, and they're huffing and puffing. Maybe coughing, maybe letting out respiratory secretions. I like to use the example of our breath in cold weather. You kind of see that nice little fine fog. Those are all respiratory droplets that we exhale. And you can imagine how difficult it can be to control that in a summertime session, fall session, where people are sweating and engaging in heavy exercise. So we've got our work cut out for us, and that's why we need to be as prepared as possible for as many scenarios as we can come up with. There's probably still a lot that we are not anticipating, so we need to be fluid and mobile to adapt to the situations that are presented to us. So I think it's very important that all of you encourage your coaches even to look at that slide about an incubation period. That's going to be really important for us as schools to go back and identify when somebody may have had an exposure. Did it actually happen at our field? Was it a family exposure outside of the facilities? And probably the bigger challenge is here, we can only control what we have control over, right? You can't necessarily, deal with athletes who are riding home together and they don't necessarily live in the same household, or their contacts out of there. So we got to work with what we've got and remain flexible. So I think education amongst our staffs and really leaning on your athletic trainers is going to be paramount to have appropriate education for what an incubation period is, what the symptoms are that you should suspect, because it's not just fever, cough, shortness of breath. It can be diarrhea. It can be upset stomach. I'm sure you've all seen the loss of smell. It can be headaches. So on top of this COVID stuff, we're going to have all the usual stuff that your kids are going to complain about in a regular year. And that makes life a little challenging. It doesn't mean you should get paranoid over any single little sniffle or sneeze or upset stomach, but you got to have your guard up so that we can identify things that may be a concern. So kind of like we talked about in the Region 20 meeting, you want to make sure you have your protocols set up for hydration, not sharing food and water. How are the athletes going to be allowed to enter your training rooms and locker rooms? What are your cleansing protocols after use, wiping down tables, wiping down equipment, so that we've got all that in place to minimize the exposures that can happen. The return to play protocol is going to be also something that you're going to really need to lean on your team doctor for. The recommendations are not set in stone. There's no one best way. You all probably are aware by now that any positive test is going to require a medical clearance to return to sport. That's a UIL guideline there. So your team doctors are hopefully going to be aware of these considerations that we're going to take into account when we have an athlete who's actually had COVID. Hopefully the majority of them are asymptomatic. There is a slide that I'll share with you briefly that was put out by NFHS and the AMSSM, the American Medical Society for Sports Medicine, geared more toward physicians, but it gives you an idea of kind of the thought processes we're having. So let me just pull that up on the screen here. Okay, so I don't know how well this shows up here. You can actually find this on the AMSSM website. They have some very good resources that you can share with your staff and quite detailed. Again, this is geared more toward your physicians, but for those athletes that had a positive test, we're obviously going to follow the recommended quarantine guidelines. So general, like they say, 10 days, 1 day without fever, without fever-reducing medications, and improvement in symptoms. For those that are symptomatic, we're going to require probably a little bit more intervention from your medical professionals. The biggest concern that we have with COVID is the possible development of what we call myocarditis, an inflammation of the heart tissue, which we have been seeing at the collegiate level, and it is a concern because it can cause damage and symptoms such as sudden cardiac death. And it doesn't necessarily have a presentation where somebody feels abnormal. So those athletes that had more severe symptoms, it is being recommended that they get a much deeper workup, including an EKG, which is a heart screening test you're all aware of, possibly some blood work to look for markers of inflammation specific to the heart, and potentially even more in-depth symptoms. The return to play protocols that exist out there, again, are guidelines. It's not necessarily the mandated way to do things, but we're following the best information we have. So for an athlete who tested positive, we recommend that they have no exercise for 14 days at a minimum, also following those return to school guidelines. And then it would be recommended, even if they were asymptomatic, to have at least a graded return to exercise protocol. Most recommendations are saying that light exercise can resume 7 days after symptom resolution once you've received medical clearance. And I have seen a few examples of protocols out there that other states are using. One big example that I'm going to show you here is from the Missouri Athletic Association, Activities Association. I really like this return to play form. It's not unlike our concussion return to play form, and it lists some of those markers that we worry about: chest pain, tightness with exercise, unexplained fainting, an excessive shortness of breath, palpitations. And this is something that your physician, team physician, can look at. And you may want to talk to your risk management departments about reproducing this. This is easily found on the internet. I just wanted to see if there was a form that had already been created. And they have a nice kind of 5-stage return to play protocol, increasing activity, just like we do with concussion return to play, to make sure that there's no development of these symptoms. And that's going to be a big thing for monitoring whether or not somebody develops that myocarditis type inflammation. That can be difficult to detect. So feel free to reach out to me. I have copies of this. I think we need to adapt it to our own institutions, but this was created using some recommendations, and it's published in the British Journal of Sports Medicine. You know, in kids, it's going to be a difficult situation. You don't know how likely they are to get it. They seem to get it less often than older adults, and fortunately not as severe. But there are conditions like the myocarditis, severe types like this MASC, this severe inflammatory response that resembles other disease. Kids that have other risk factors like diabetes, kidney disease, lung disease, or other congenital abnormalities seem to be at higher risk, and hopefully they're not going to be as likely to transmit it. So we've got a big challenge, and I think the biggest thing that we can do is have those protocols in place and ready to go, just like you would practice your emergency action plans. A lot of people have been asking, well, what do we do to minimize exposure? Your practices, you want to try your best to probably work out in pods. So maybe groups of 8 to 10, defense and offense, or position groups. That way we can, at best, minimize exposures if they do happen. There's not going to be an easy answer in all situations. You may not have the staff to make that happen, but we're going to have our work cut out for us finding out best practices. I really think the smaller divisions that are already started, we really need to lean on them and see what has worked out well for them so far. They've had some trial and error already, and are kind of not needing for us to reinvent the wheel here as we get these processes in place. Many people ask me about masks. You know, if you look at the professionals, the athletes that are competing generally aren't wearing masks as they play. I know some of the baseball guys do it. So it'd be a lot more difficult to do that in a football type setting. But if you look at the ones on the sidelines, they are wearing their mask while they're not competing. So that's something we have to see if we can put into play. There is some talk about the quality of a mask you use. So a small informal study about gaiters was done, and showing that they actually allow a little bit more transmission depending on the material. So if you're using gaiters, it's actually recommended that you double up or have one that's heavy cloth, because some of those are pretty open in terms of allowing some of those respiratory secretions to transmit through. Many trainers have asked me, you know, should they play in masks? Well, you certainly can oxygenate, but in our heat and humidity, those masks are likely to be sopping wet within a matter of 5 to 10 minutes if you sweat like I do. So, you know, it's going to be difficult to keep those kids using them. There's not going to be an easy answer for that. We hope to be a resource for you guys to continue to update the protocols. We're happy to see any of your athletes. I really wanted to take this time to discuss more specific questions you guys have in terms of what challenges you see that we maybe can help you with.
And go, anybody.
So I guess what I'm struggling with is, I understand what you just said about the mask, but if they're on the field, let's say in a football game, and participating in the actual game and not on the sideline, then do we have them wear masks or not wear masks?
I don't think you can mandate it. Certainly people can try, but I don't think you're going to have many athletes that are going to want to wear the mask while they're competing. It's just going to be difficult for some of them to breathe properly. You know, that's the tough question, right? Everybody's probably wondering about that cumulative 15-minute time period when they're face-to-face, huffing and puffing on each other. This probably would fall under the, well, technically it doesn't count. Some protection is probably better than none. But, you know, it's not going to be foolproof. So the other thing I don't want the kids to kind of have the idea of is that, well, I'm wearing my mask, I'm safe. So that education that we're doing for our staff also needs to bleed down to them, and get them to understand what they do outside of sports and school can affect the teams. You know, so good hand hygiene, you know, staying home if you can, and all difficult to do when you're handling hundreds of kids. There's not any definite evidence that shields like you'll see placed in the face masks will be a good barrier. It certainly can help stop that transmission of droplets. I think masks are still going to trump that, but I know many of those are being considered as just another way to put up some type of barrier. Even the masks, you know, unless you have an N95 mask that blocks all transmission, you know, they're not foolproof. Another comment on the type of masks, the ones that you see out there with a valve, they're one-way valves, so those are not sufficient by themselves. You want to put some other type of cloth or filter behind that as well. I think if you have a more thick gaiter, there's not a definite material, but most of the recommendations say a heavy cotton type cloth will be probably the best to use because you can also wash it.
Do you have any other questions for Dr. Lopez?
Mel,
Dr.
I
Lopez?
just have a quick
Go ahead, Sam.
comment. I know somebody else may have something to say, but Dr. Lopez and Dr. Curran, I want to thank y'all so much because y'all have brought a lot of clarity, to be quite honest with you. I know there's a lot of questions still, and this is going to be a tough deal, but you know, the information provided today, I think was very beneficial. So thank you. I know we don't have any easy answers, but thank you for your commitment to help us in every way you can.
Absolutely. And Stan, going back to a question you had asked me a while back, you know, if I get one positive kid, do I have to shut down an entire program? My answer is probably still maybe. But this is where that contact tracing is going to come to be vital so that we can figure out who is actually exposed to those kids. And if you are able to put groups of players in practices in pods, we're likely to minimize that and figure out who actually needs to have a quarantine period and hopefully not have an entire shutdown.
Dr. Lopez, could you share your slides with me so I can share to the group? I know some have asked.
Absolutely. I'll also give you one. I have a presentation we'd like to give later. We'd be happy to invite you all. I've compiled some resources from various organizations that have a lot of guidelines and similar slides to the one that I showed you. Highly recommend you spend a little time digging through them because you may find some information that will help your particular situation. So I'll be happy to share those.
Great, thank you. And I really appreciate your time today and want to kind of mirror what Stan said. I think we got a little bit more clarification. You know, we still obviously have questions, but I think that, you know, the water was a lot muddier about contact tracing. And, you know, again, I wanted to get that information out for the risk factors to our athletes because I think that's important. So thank you, Dr. Lopez. We appreciate you being here today.
Thank you for having me.
So are there any more questions for Dr. Lopez before we move on to our panel discussions?
Hey, let me follow back up with one thing that Dr. Curran did say, because Kelly asked the question about the masks. You know, obviously not considered a contact if they're wearing them. Now, I know in our meeting last week, that was debatable, whether or not that was. So, and again, it may be a tough question to answer, but I know there's two thoughts on that. So I don't know if you could elaborate on that.
Yeah, it's going to be a challenge. So, you know, I'm in front of people all day long, and we're wearing masks, both patients and physicians. So, you know, we're technically not considered a contact, even though we're not 100% protected. You know, I think if we can institute the use of it, we're only helping ourselves to minimize that potential spread if it's there. And whether or not it works well in the field, you'll probably have to take it on a school-by-school basis if you wanted to try that. But the time will be cumulative as they line up against each other. And I think the best thing we're going to be able to do is identify anybody who may be symptomatic or had exposure prior to allowing them to practice and compete. And those screening procedures get quite annoying, but for us to make this a go, we're going to have to be on top of that to minimize it. And the really difficult ones are those that are asymptomatic. There's not an easy way to find those. And I've had some in my own family who have no clue how they got it. And that's really challenging.
Dr. Lopez, quick question. So we mandate everybody has to wear a mask, obviously, when it comes to coaches.
Right.
So they're at practice all day and stuff, and they're still trying to stay distance and all that. But let's say over the summer, we had more coaches test positive than we ever had a kid. I think we had one kid, and that was a interesting situation. But so let's say a coach gets it, test positive, but it's been wearing his mask the entire time, or her mask in volleyball. Do you think we'll need to figure all that out and shut it all down, or how does?
It's probably going to be considered a close contact because of the positive test. And that's where you kind of monitor for the symptoms in the shorter quarantine. So that's kind of a nightmare scenario, right? You have coaching staff or trainers go down because of something like that, not just kids.
So with the mask, it's irrelevant still if they're wearing that mask tight to their face and doing all that?
Positive, yeah, you're going to be more at risk, hopefully protected, but that's something we'll have to monitor as they have that exposure. We've lived in constant fear of that in our office because if one of us goes down, an entire team can go down, and it's been quite a nightmare, to be honest. The other
go ahead.
I just want to bring this up because I have encountered it more recently. You can have individuals who had COVID months ago and they have continued to test positive. That doesn't necessarily mean that they're still infectious. So you'll still have antibodies, and they may have enough virus components that if they get tested, they'll continue to have a positive test. So that's where stuff like the symptoms and the contact tracing comes into play. I had an individual who was infected back in June and continues to test positive, but hasn't had anything since that time. So that person is no longer under that infectious period that we worry about. And you may encounter that with some of your staff if they happen to get tested and they had it in the past.
Thank you. Anybody else? Okay, well, Dr. Lopez, again, thank you for being with us. We appreciate your time, and be safe out there.
Absolutely. Reach out to me if you need to, folks.
Thank you. Okay, so we're going to move on to our panel portion of this, and I'm hoping that we can gain some information sharing with one another. We're going to begin with our 4A and below divisions. Coach Miller from Marion had reached out to one of my emails and shared his mitigation plans. And so I know that a lot of y'all have started. I know that with Tina Guerrero over at Fort Sam, they're under the Bexar County health ordinance, so they have not been able to start. So I want to talk about some of those things, talk about what you guys have done, what you've put in place, what worked, and some things that maybe we're not anticipating that you've encountered. So Coach Miller from Marion, I'm going to go ahead and open it up to you and have you share.
Absolutely. Thank you, Melanie. I think the big thing for us, we've been going since June 8th, and we've been very fortunate to go pretty much, we're on week 11 or week 12 right now, and have not really had any cases. And obviously we're in a smaller community, which does help, but we're surrounded by a bunch of big 5A, 6A schools around us. So, but one thing we have implemented right away was masks. I mean, it's been mandatory, and people don't really call me a football coach this year. I'm just the enforcer. And I go around volleyball, football, and that's all I do is, hey, put your mask on, get 6 feet apart. So that's one thing we've been on them about, just really enforcing those rules. I know for football, when it comes to mask, it is on 100% of the time. If they can wear it when they can play, they're playing. We've already scrimmaged another school. Like I said, we've had no incidents yet. We've been practicing, going into our 4th week right now. So I feel like it's working. But I think the masks right now are the huge things. Obviously, another thing we've talked about as a coaching staff is we've kind of implemented a 6-foot coaching rule. So all of our coaches are trying to coach, which is extremely hard. But all of our coaches in volleyball and football right now are trying to attempt to coach from a distance. And I think somebody just brought that up about, the whole mask issue with coaches. If you can implement the 6-foot rule with coaching, I think it's going to be very beneficial. Then if something did happen, hopefully your coach is not out. And obviously it goes back to that cumulative 15-minute rule. Hopefully you're not going to get stuck with that. So like I said, the 6-foot rule with the coaches, the mask, just going around enforcing it. We constantly have, I constantly email out reminders. Hey, make sure your players are wearing it, make sure coaches are wearing it. It's 100% mandatory for coaches to wear it 100% of the time. No excuses. One thing that's the biggest fear that I have is locker rooms. I know that's on here later on too, and hydration protocols, but locker rooms is my biggest fear, and it constantly is. And what we did with that was we did not allow any of our athletes locker room access until we started in-person school, in-person learning. So for football, what we did was we gave what we called outdoor lockers, and we taped up their names, gave them name tags around the track. And they said it was like popcorn or football. You show up full pads, helmet ready to go, and you come practice. As soon as practice is over, you get in your car and you leave. So that's one thing we did until we started in-person learning 2 weeks ago. So we did that for a couple weeks, but they brought all their equipment. They took all their laundry home. Like I said, it was just kind of like when they were little kids, just show up ready to go and get their practice in and go home. So that's one thing that I think worked pretty well right off the bat. I know for volleyball it's the same way. They're not allowed any, they weren't allowed any practice or locker room facilities. So they showed up ready to go, brought their duffel bag. As soon as practice was over, they got out and they left. We have hand sanitizing stations set up constantly throughout our practice field, throughout our gym. And anytime if a player needs to go over there, they can get a shot of hand sanitizer and get right back in the drill. So it's things are kind of slowing down. Our practices aren't as up tempo as I think probably most coaches would like it to be. But it's obviously safety is going to be our number one priority when it comes to that. So if a kid feels like he needs to get a shot of hand sanitizer, we're going to let him. I know a couple different things for hydration. What we've done is obviously everybody had to bring their own bottle of water, their own jug of water. What we did for football, we set up 4 what we called refilling stations, 1 behind each goalpost, 1 on the 50-yard line on each side, and we manned a student trainer to that refilling station. So at any time during practice, that student could or that athlete could go over there. They don't touch the refill station; only the trainers do. They're wearing gloves, they're wearing masks, and they refill it right away, and the athlete gets back in the drill. So that kind of takes away the sharing. Volleyball, what we did with them, we bought them their individual water bottle, the Gatorade water bottles. We bought them, and we kind of have 2 tables set up in the gym, and they just have their names on those water bottles. They're on there. Then if they're active in a drill, we have an athletic trainer filling those up, unscrewing the lids, filling the water up, putting it back. And so there's always water accessible. Obviously that's one of our big things going into this season was how you're going to get kids water without sharing water bottles. So that's a few things that we've kind of implemented the last couple of weeks. It seems to be working really well. Like I said, I think the locker room was probably my biggest fear. Like I said earlier, when we did allow access, when we started school, because we were having the athletic period, we send them in waves, and it is a pain in the butt. We got to cut about 15 minutes of practice off right off the top. And so we're sending them in waves. I know for football, I know for us, we're trying to get 100 football kids in. So we send them in by position, like I said. So we try to get the freshmen in a little bit earlier and then trying to get, the JV offensive linemen, defensive linemen, skill guys. We just kind of rotate through the days, but we're building everything into our practice schedule. Like I said, it's kind of slowing everything down and you're taking away practice time. But I guess the big thing is you're making sure that, safety first, and that's our number one priority.
Thank you, Coach. Coach Quisenberry, can you talk to us about Divine America and tell us what you've encountered?
Yes. First of all, we're just like Coach Miller. Our kids are wearing masks from the minute they get out the car. They practice in them, they play in them, and we scrimmaged last week in them as well, and we even ran sprints afterwards in them. We never take them off unless unless you're getting a drink, and then we get you away from everybody. Everything's almost exactly like what Coach Miller said. Difference now, we have athletic period during the day, and we do a lot of specialties during the period. So our kickers and punters and snappers will go first, followed by return guys, and we'll just kind of go down, prioritize it that way as far as getting in and out of the locker room. We have refill watering stations. Our kids bring their own thermoses. And they take them with them from station to station. And we have designated people to refill thermoses, watering stations we've rigged it up to where it's non-touch. We hit a pedal and water comes out, a foot pedal. As far as coaches, it's 100% mandatory. You wear your mask. It's not an option. And so far, it's worked out really well. We've only had one positive case, but because everybody was masked, only that one individual had to be into quarantine for any period of time. Outside of that, it's the mask are the key. If you wear a mask, you got a chance to. I feel like we got a chance to get our season in.
Thank you, Coach. Coach Sosa, could you talk to us about how you've handled spectators, things like that at volleyball games, what your plans are for football?
Is this still me?
No, it can be you. I was going to hand it over to you.
No, I'm sorry. I'm trying to click off. I didn't hear you. No, we have everything marked.
Okay.
Everything's marked for us. As far as football, every football parent, band, cheerleading, they got to request how many tickets they want, and they have reserved seating, and we'll have like 80 general admission tickets. And then on the visitor side, everybody gets 2 tickets, and we can seat up to 290 people with 6-foot social distancing. All right, I'll get out of your way now.
Thank you. Coach Sosa?
Yeah, we've hosted 2 volleyball games, and right now in our bleachers we have every 3rd row. We have two rows that are blank. They're marked. Obviously, when they come in, fans are screened. We have temperature checks. We don't have concessions open at this time for that reason. Parents, spectators understand they got to wear masks the whole time. Basically, we put in our rules that you get a warning. That's 1 warning. Second time we tell you, we're going to have to take you out of the gym. People have been really receptive and understanding. It worked out pretty good. After the freshman game, we had everything in one gym. Now, come district, we'll use 2 gyms, but right now we're doing everything in one gym. And after the freshman game, for example, we're asking the parents to leave and vacate the gyms. We have room. We have lists from the visiting team. I tell our ticket people there that I don't want visitors coming and then being turned away. So the visitors have priority. We're asking our fans to be courteous enough to, after they get through playing, to leave. So it worked out pretty well. The first game we had, second game was the same way. Football wise, we'll have our first game tomorrow as far as sub-varsity. I'm not too worried about sub-varsity game. I think the fans will have plenty of room for them. But again, we're encouraging them to wear their masks. I don't know how you'll enforce that in the stadium. In the gym, it's easier. We have security there. So that's going to be something interesting. I know our Butcher Club tomorrow night will not have any concessions. They just kind of want to wait and see. In our last scrimmage last week, everything went well. Cuero was pretty relaxed about it. They said, hey, you guys take care of your own people. And we have plenty of room in the stadium. Everybody was social distance. I think parents understand the importance of it, and they're following our lead. And that's part of, that's the job we have to do. We have to convince them that their kids are going to be safe. And I think as long as you do that, I think we got a chance.
Chris, Barbara asked a question. Who's monitoring the mask wearing for your spectators?
As they walk in, obviously we have signs. We have security here on campus, and they're the ones responsible. Of course, our administrators also are walking around and making sure. But as far as I know, that first game we had, no problems. I mean, the parents had them on. And for that reason, we're not having concessions, because when you have concessions, then you got to take it off to eat, and then they may not put it back on. So we're going to sacrifice that part of it, I think, all year inside the gym. Outside, it'll be different. I think it's a lot, people feel a little bit safer outside. You can social distance a lot easier. The biggest concern I had in our people, you know, we wanted to kind of vacate the gym or ask them to leave, and not everybody left, obviously. So they went on the court, and while our people sanitized the stands, and I didn't want that taking too long, but it seemed to go pretty smoothly. We had about 3 or 4 janitors that came in there and cleaned the stands, wiped them off with this machine they had and sprayed it, and went pretty fast. So again, we want people to feel safe, and we're doing our part, I think.
Thank you. Terry, I'm gonna throw a question over to you real quick. How have you guys handled locker rooms and hydration?
So, you know, locker rooms, one thing we've done is we've staggered the lockers in the locker room so the defense and offense are mixed in with each other. So if we have to send the offense in first, they're spread out through the locker room, and then the defense goes in. That's one thing. Another thing we do is in a lot of cases, we tell them to take the laundry home and do it themselves. So it's in and out pretty quick. And then freshmen, you know, the freshmen are last period. And so as soon as they get done changing, we send them outside to wait for the bell, just so they're not gathered in the locker room at the same time. As far as hydration goes, similar to what these other guys have done at football practice, they bring their own bottles. We have student trainers refilling with gloves and masks. And for varsity game nights, we're going to use cups. So all cups, and, you know, we felt that's the best thing to do on a Friday night. For volleyball, and this is we're having talks about volleyball and then sub-varsity football games as far as what we do for the visiting side. So for volleyball, we kind of decided to do for volleyball and for visiting football teams on a Thursday is we're going to set the coolers out for them, and they can bring their own bottles or cups or whatever. And then we're going to have hand sanitizer next to the cooler. So every time you use a cooler on the visitor side, we want you to hand sanitize first before you touch it. And hopefully with football and volleyball too, you have student trainers there that can do that. But if you don't, we're hoping that at least you use the hand sanitizer before you come in contact with the cooler. So it's just difficult because it's hard to control the visiting side for sub-varsity football and for volleyball. We can have more student trainers there from our end, but if we can rely on, you know, when we got together and we Zoomed as a district as the athletic trainers, and we all kind of decided that's what we're going to do together. So we're all doing the same thing. And I highly recommend you recommend it to your athletic trainers in your football districts or your basketball districts or whatever to get together and Zoom together. We Zoom together every week, and so that we can make adjustments of what we're doing at each other's places, and we can know that when my kids go to Kerrville or my kids go to Fredericksburg, that everybody's doing the same thing, that we're all taking care of each other, so that we're being, you know, we have the safest environment and we all agree on everything, and we can make adjustments weekly as we need to go. So that's kind of some things that I would recommend.
So Terry, I know you guys are back in school and face learning. Brian Clancy had a great question. How are you handling the showering of those kids that have to, after athletic period, go back to class?
So showering wise, we get them in and get them out quick. We make them wear a mask and get in the locker room. Obviously, not wearing a mask in the shower, but we are highly encourage them to get in and get out as quickly as possible. And it's worked pretty well so far. Our biggest concern is with in-person learning now is not things that we can control in the athletic department, because we can control a lot of those things as far as social distancing and what we do, our practices, but it's in the classrooms. You know, if they're sitting in a classroom with 30 kids, it's hard to socially distance in a classroom. And if a kid in a classroom gets it, that's our biggest concern.
Thank you. Coach Leach, how are you guys handling your ticket sales? Are you doing online ticketing? Are you doing season passes? Are you accepting senior citizen passes? Things of that nature. You're on mute.
Thank you, Mel. What we're doing is we got it off online, and the reason is the company that we went with, it was too difficult to deal with all of the things that we need to deal with. So what we're doing, for the game with Chris on Friday. We've got 2,000 tickets. And so that's what we're selling. And when we're finished, we're finished. We've done online before, but with all of the things, send them to the Bernie High, send them to the Rock House, the stadium. Also, we allowed all of our season ticket holders to have 2 tickets in the reserve section. You know, that's a group that we needed to give something to, and so that's how we dealt with it, is gave them the opportunity to buy 2 tickets in that area.
Thank you. Keith, can you talk about Somerset, how you're handling spectators and any incidents you've had? I think your mic's off.
There we go. Sorry about that. Hello, good morning. Actually, Mel, here at Somerset, we're still haven't started anything yet. We're actually sliding into volleyball, looking to have our first game on Saturday against Jordan, and then looking at actually starting up football. We've kind of worked the kids into their pads. I know that Chad had talked about the plastic face shield. We have purchased a plastic face shield for every one of our kids, so I don't know if y'all can see that there. So we're right now, I'm in the process of like the 5A groups. I'm out going scouting. I'm scouting different facilities and checking on not only what's going on athletically, but checking out the concession stands. How are concession stands being run? So hopefully we'll end up getting things started up here. We're looking at possibly our first game will be on September the 11th, football wise. So we're stepping into things slowly. Football is, we got kids out there. They are right now just starting into pads this week.
Thank you. In talking about the face shields, I know Sylvia and I have had this discussion. We were under the impression from Rydell that face shields would quash your warranty on your helmets. Did you guys get any information on that?
I haven't got the full report from that as of yet and stuff. I'll end up having to talk to Chris Hoodman over there.
Okay, great. Leanna, can you share with us what's going on in your 4A world?
Sure. What do you want to know? Well,
How have your volleyball games and everything been going? I've seen you post a lot of pictures.
I think, well, we're playing, and so I feel like that's a victory in itself. We opened our new 4A high school this year, Davenport, and they were our first match actually that we hosted. So it was baptism by fire for them for sure. We are 100% online ticketing, and we are using Brushfire. And so that so far has been going very well. I was nervous. I was very nervous about that because we have always encouraged, don't stand in line, buy online, before you get there, to avoid the long lines. However, with the guidance and the recommendation and with our familiarity, I guess, with Brushfire, we've been able to utilize that. And I think our statistics are showing with each game night, we're having less and less purchase at the gate. The first night, it was probably 50 out of 230 or so at Davenport. And then the next night it was 30 something, and then it's dropping. We have a timeline that we share with the opposing coach, and for our volleyball, if it's on a Tuesday, we open it up on Sunday. For varsity parents, we open it up for first with a code, and then general goes after that. We have a timeline also for football that we're using. So we host our first football at Davenport again on Friday. And then next week, Canyon Lake. We have sub-varsity tomorrow at Canyon Lake, but our first big crowd will be Friday night at Davenport, and then next Friday night at Canyon Lake.
Great, thank you.
So all online, and so far, if the big question was passes and all of those things, what we're doing is asking if anybody like within this group who would like to come and see it, just email me and I can send them a comp. That way I can account for it. The only group that we're really not requiring advance notice is our senior citizen card, just maybe because, well, one, 3 or 4 a match probably is what we're getting. We feel comfortable that we can accommodate them. And I don't have the heart to turn them away if they're going to venture all the way out to one of our campuses, because we're quite spread out and we're far from everybody. But the rest we're asking to let us know. That way we can send them an e-ticket.
Great, thank you. Tina, I know you guys haven't been able to start yet. Can you kind of talk about how that's going to affect your seasons?
Yeah, we're definitely, hi guys, good morning. We're definitely at a disadvantage. And we've got Coach Miller's here and we're in the same district. And so, you know, them starting August 3rd and most everybody in the district, with the exception of us and Catula, have not started yet. So, you know, the one thing that we're a little worried about is the safety of our kids starting so late. But we finally did get the green light this week to have our kids to just condition as long as we're social distancing. And just like Coach Quisenberry, our kids are required to wear a mask. Now, obviously, you know, that first day we went about 15 minutes and we had just kids, you know, keeling over and getting them in the shade and stuff like that. So it's going to be a challenge right now with them trying to get accustomed to having that mask on at all times. Obviously, they take it down when they're doing running drills. But anytime that we transition from drill to drill, they have to put it up. Anytime they're waiting in line, they have to put it up and try to remain 6 feet apart. So, you know, those are the things we're doing for the football. Obviously, we have our water stations where we have only student trainers and the athletic trainer able to refill. They're required to bring their own water. What we've done prior to that, we've sent out a lot of surveys because we are back in school virtually, 100% virtually. And so our kids have to pre-screen before they come in. So we have our pre-screen spreadsheet roster, and if they're not on that roster as checked off as they have completed the pre-screen, they're not allowed in the stadium, in the gym, or at cross-country practice. So we've also done a Google form pre-screen if they had COVID, because if they have tested for COVID prior to them, you know, coming up here, then we do have to have that doctor's note before they can even come up and train. But right now we're strictly doing conditioning. We're not even in the weight room right now. So we are going to be at a disadvantage, but at least we're able to gain a week or two before the 7th. If we do, keeping my fingers crossed that we do get to start on the 7th, so we don't have to do that strength and conditioning week, which will give us a week, which will possibly give us a game before we even have to start our first district ball game October 2nd. So, you know, our parents have been super supportive. Our numbers, you know, we did survey the parents as well on whether or not they would even allow their kids to come back and play. And our numbers have been really good. So I don't think that's going to be an issue. But we're taking it one day at a time and seeing how our numbers are growing every day. And then we have our safety, our medical safety plan, and that was done by our student trainer, which we're going to, our athletic trainer, which we're going to post this week, and our return to reopen plan as well. So we'll be posting that on our website for our parents and our faculty and staff. We're not going to have fans in the stands this year, you guys. I mean, we've just decided that that's going to be too hard to control. Our number one concern is to be able to have seasons and be able to finish them. And I think that, you know, allowing people in the stands is going to be a challenge. We've already got a couple parent complaints, but, you know, it is what it is, and we're going to do our best with what we have. Our main concern is to have our seasons, and we will live stream. We will do online tickets to avoid, you know, congestions. That if we do decide after Thanksgiving break to have fans, and we will reevaluate that at that time. But it looks like the fans this year is going to be a challenge. I'm not sure that our superintendent is wanting to take that risk. So it's just a day-to-day thing for us right now. We're just trying to get our kids back into shape because we've been off so long.
Great, thank you. So for those of you that have been playing, a question came up to me yesterday, and I know that it's recommended that obviously we have to do screenings of all of our event workers, our ticket salespeople, officials, things of that nature. Are you guys that are currently in games doing temperature checks on the visiting teams as they enter, or are you relying on the visiting teams to conduct those self-screenings and temp checks? Any of you guys can answer that.
We are not, Comal is not doing temperature checks. We have the huge signs at our entrances, and I'm asking our coaches to communicate with the visiting coaching staff. That's been some heated discussions in some of our decks, that professionally we respect that we are taking care of it with our own kids. Comal, we screen every day when they get to school. And of course we're doing all our game workers concessions, those guys. We are having concessions, but it's limited, and we're asking them not to take it into the gym. So it's all prepackaged, all those guidelines and all that, but we're not doing temp checks at all.
Okay. Coach Sosa, Coach Miller.
Yeah, Beeville, we are screening people as they come in. We have temperature checks as well. And obviously if the visiting team comes earlier, we screen, temperature check them as well. And of course our kids every day. But yeah, we're doing that.
So it's safe to say we probably need to put that in our plans to our opponents if we're going to be conducting that, right? Have you had any pushback from your opposing teams on that?
Not in Beeville. Beeville, I think everybody's just happy to be playing and they're complying. It's one of those things where that's what our fans are doing too. We require a list. They send us a list, freshmen, JV, varsity parents. We kind of mark them off as they come in, just making sure that we accommodate those parents first. Right now, again, everything's, it's trial and error. I told my administration, we got to tweak it, we'll tweak it. But right now, the numbers were good. The gym, social distancing was there. It looked good. I was more impressed than anything else, especially not knowing what was going to happen. But again, it'll be curious. I know we're playing up at Bernie this week, and football wise, football's big, and that's going to be a challenge. I think, Stan sent me 400 tickets. We got people lined up. They want to go. And what we did there, just to kind of share with you, Monday and Tuesday, we sold to our parents first of the players and cheerleaders. Our band's not going to attend. The drill team's not going to attend. So we want to give those parents priority. And then, of course, Wednesday, Thursday, Friday, we'll sell to the general public. So that's kind of what we're doing there on tickets.
Great, thank you. Coach Miller?
Yeah, we're not screening visiting teams that are coming over. For all of our spectators, we are doing a verbal screen. We have a big poster with all the symptoms on there, and it's just a simple yes or no for all of our spectators. And all of our workers, we are temp screening all of our workers. So officials that come in, clock, book, all those workers, our trainers up there, he's going to screen them with a temperature check, then a COVID symptom check also. So yeah, it's interesting as you go. I know for us, we closed off all of our practices and scrimmages. Then we just kind of eased into it. We hosted, I think Davenport actually came over for our first volleyball game. We said home fans only, just to kind of see where we went with it. Then our second home game we hosted for volleyball, then we allowed us visiting. So we nobody went home only, then we went home and visiting. So we kind of just eased into it nice and slow, where we can kind of work out all the kinks as we move forward with that. That seemed to work pretty well. And obviously we'll host football here in a couple weeks, and when we have a first home game. So that's definitely going to be interesting as we move forward with that one.
Great.
Well,
yes.
I'm sorry to interrupt, but I just want to say one bit of advice. If you're doing online only is, you might want to consider giving your principal admin rights to your ticketing, because we have done that with our 2 that are going right now, and they keep an eye on ticket sales, and that helps them look at how many adults, how many students, and how many admin in case they need to add extra. And it just keeps everybody informed of what's, if we need additional work, or just keeps them aware of what's happening. And that's something that we lived and learned through our processes, and just know you're going to tweak what you do. And the numbers were the biggest thing for us as far as seating and making that change, because it's really about 25% to do it right and do it safely. So I just wanted to, I forgot to say that earlier.
No, appreciate that. That's
Mel, can I ask a question? For those that are currently, hosting games, and if you have, are we, or is the visiting team required to advise the home team if one of the fans that attended the game, if they tested positive? Like if somebody attended your game that evening and they tested positive, are you required to advise the home team?
I don't think you're required to do that, and that's something I'm going to go over in the officials update.
Okay.
But as far as for spectators, now we do have requirements for players.
Correct.
But I mean,
We'll have to. You will have to
I mean, I'm just saying, you know.
HEB and knowing you're positive. I mean.
Yeah, but volleyball in a gym, I guess, would be different from a stadium. But I was just wondering.
But we're really strict on forcing social distancing from the players and then clearing the gym when they're done. They go outside back to their cars. So, and when I talked to another AD this morning, he's a 5A AD and he wanted to talk. I said, as much as you're coaching your coaches, you're going to coach your admin up as well, and letting them know what's within their rights, because if a team's not wearing the mask like they're supposed to, you can halt the game and say, hey, you either comply or we're done, and they lose. And I happened to be on the phone with Dr. Elza one day when we were at my first volleyball match at one site, and I'm like, what is within my jurisdiction? I don't know if that's what Mel's going over or not, but so we're coaching up our admin when we have our meetings on protocols with them as well, and it's live and learn. And we're not out to get anybody. We let the coach go through the match, but I had a conversation with her because there was a duel, and I had a conversation between matches like, all right, this is the deal. Just so you know, if this was a district game, you know, or this is the beginning, we want to start it right, you know. So it's just working together and helping each other through this because it's tough.
You know, Mel, the streaming of the volleyball games, we've streamed 2 of ours, and we're going to plan on streaming our volleyball and football. That has helped us a lot. And them knowing that we were streaming did keep people away. It seems like normal years we're trying to get everybody to come to the games, and now we're trying to get everybody not to go. And to have a way of letting them watch it has helped us. Our middle school games will probably all be at the stadium so that we can let everybody in and not have to worry about the numbers. And so right now we're currently going to play all our middle school games, all 3 schools at the stadium, so that we don't have to tell anybody no.
Gotcha. Guys, I appreciate that. Yes. Who's that?
Dan, who are you using to stream?
Bowick, and then we've got the Greyhound Sports Network, and then the Charger Sports Network on YouTube. Leanna has experience with them also. They're wonderful. Of course, Larry has done a tremendous job with them at Smithson Valley, but I can't brag on them enough. Leanna can speak to them as well.
Yeah, Wig Productions is extremely professional, very kid oriented, they're top notch, and very supportive. And they're still working with 2 of our campuses.
Great.
Anna, can you give us a rough estimate as to what that cost you guys per school?
No, I can't. Sorry. Brewster Club's doing some of that, and our communications, that didn't fall under my umbrella. I just have experience with working on, but I don't budget that. That's not coming from, I don't oversee that part of it. Thank goodness. I know it's expensive.
Suzette, I can speak to that. They also do the video at the games for 10 home games and 8. And then volleyball games, it's around 30,000 a semester. And so basically probably 15,000 a school.
Wow. Thank you.
And sponsors pay for it.
Sure. And I did talk to him just a couple of days, Suzette, ago, because talking about streaming maybe for like Davenport, who's non-varsity, they don't have the big screen like Canyon and Smithson Valley, and they can do that for a nominal fee. They just send a camera and push that through like a YouTube, because we already have like Ranger Network, Cougar Network, all those things, and I think that's like just $200 for somebody to just show up and do a camera for live stream. So that might be something. I thought that was a nominal fee for what you would get out of it.
But Suzette, what we're speaking of, we have they have a broadcaster, Brant Freeman right now till Smithson Valley starts playing football, and then have 7 cameras at the stadium and 3 for a volleyball game.
All right, thank you guys, appreciate it.
Thanks, guys. I appreciate you guys sharing. I want to go ahead and move on to our 5A and 6A folks because.
Mel, I'm sorry to interrupt. I want to ask these guys a question before you come to the 5 and 6A, especially of football coaches. Going back to the cumulative 15 minutes of contact, have y'all taken any consideration as you do your practice schedule of looking at, as far as drill work and that type of thing, that cumulative 15 minutes? And I'm just thinking about documentation purposes in regards to not for us, not if, but when we have a kid test positive. Have any of y'all looked at that as far as you can document that as far as your cumulative of 15 minutes?
Stan, we had talked about using practice film.
Yeah.
And maybe identifying, if we have a kid come up positive, when we go back and review practice film, we'll be able to possibly track who he was in close contact with or she.
Okay, and then just take the cumulative time from that practice film. Okay.
Yeah, we were looking at a second camera, basically just videoing you're cutting practice, but having just a second camera that just rolls for 2 hours and just finding some place to store it for a week or two. If something comes back, you can go back and look at those certain specific days that kid was there. I don't know where we'll store it with all the huddle space, but
gotcha. Gotcha. All right. Thank you for that. One other question before we go on, and actually Terry and Stan brought this up, and for us right now, we're 100% virtual learning, but we will be transitioning into in-person. And obviously, I'm well aware of what you guys are doing with the virtual in-person. You guys brought up a very good point. In classroom, and the concerns about kids having to be quarantined in the classroom. To be quite honest with you, as I think about this, I'm not so sure, and I don't know publicly you can say this, but maybe you do. If you're interested in extracurricular activities, maybe you need to consider virtual learning a little bit longer than going back in person. I don't know if you guys have had that talk at all.
My daughter's a senior this year, and that was the one reason why she didn't go back to school. She's doing all virtual until the end of volleyball season, and then she'll go back if she wants to. She'll go back to face-to-face after volleyball when we switch 9 weeks, and then see how it goes when softball season starts.
Well, and to that point, of course, Stan and Terry know I've got one in their district, and we gave him the choice, but his motivation was going to see girls. But I think to y'all's point, though, I think that may be something he needs to rethink on this deal. Because
that was a hard conversation for us too, because she's in all kinds of stuff and she's just wanted to be there. But I said, and what happens when you don't know Joe Schmo and you end up, your statistics class gets completely quarantined and you miss 5 volleyball games because you wanted to go to statistics class in the school building and stuff. So
just something to think about, I know.
Well, Stan, just to reiterate what Terry said so well at the beginning, is that our big point of contention has been the classroom. It's not been what's been going on at our volleyball games at Bernie High, our football practice at Bernie High. It's been the classroom so far.
Mel, I just wanted to share something, a conversation we had at our coordinators meeting yesterday. Because one of our trustees, contacted us and said, God, maybe we can create like a bubble situation like they do in the NBA. And I said, well, sir, we can't exactly send all our athletes to hotels, and keep them there. But during our conversation with the coordinators, they said, Coach, do you think that our school district would allow us to create an internal bubble situation where the football players come in and we keep them in the field house or somewhere where they can continue with their online instruction, but on campus, away from the the students, to minimize that fear? Because everybody says it's not going to happen in our programs, but it may happen in the classroom. So maybe creating a type of internal bubble situation. I don't know how that would work. It was just a conversation that was on the table, but it's something that we definitely may explore as we transition back onto campus. So just a thought.
So I'm gonna switch over to our 5As and 6As. I know that Scott's been going, Comal's been going. I'm gonna ask Andrew Roars and Lee Crisp to kind of comment on how things have gone for them, what they've encountered with kids that may have tested positive. These guys haven't shut down. They've been going strong, and we get to play them. So Lee, I'm gonna go ahead and turn it over to you.
All right. So we started June 8th like we were allowed to. We had over, between our middle school and high school, we did everybody at once. We did run our camps at 3 different locations. So Medina Valley Middle School, Loma Alta Middle School, they all ran their own camps, and we had our high school kids up here. And there were a little over 500 kids that registered and were coming to camp at the beginning of the summer. Now, the July shutdown, we took the advice of the OIL and went ahead and shut down for those 2 weeks. But we started back up as soon as we could, and we've been building our numbers back up. The last several weeks, we haven't stopped. The last several weeks, it seems like we're gaining momentum. The very beginning of the summer, I think it was maybe the second weekend, we did have a positive case at Loma Alta. The student had not been at camp. The parents had kept him at home. We went ahead and sent home that pod because just out of caution, we sent them home for the 14 days. But everybody came back. None of those athletes, got anything. Everybody came back and we're good to go. Most recently, we had a high school. One of our football players tested positive about 2 weeks ago, a little over 2 weeks ago, and we've been trying to maintain that kind of pod structure. There's been a little bit more intermingling among our receivers and secondary guys because we're doing some 7-on-7 type things, but it happened to be a lineman, and they, those guys and probably have done the best job, our offensive line, of maintaining the social distancing and the masking. And, my coach was, that guy never takes his mask off. I think he showers in it. So, but we went ahead and sent that group home, and, they just got back on Monday. And so we're looking to get kind of rolling back into it. But what we found is that both of those cases came from home. It was a parent that came home sick. Both kids were asymptomatic, no issues. The lineman I spoke of earlier, he was asymptomatic when he came, and the only reason he got tested was because his whole family was, one was exhibiting symptoms, and so they all went to get tested, because just to be safe. And turns out he had COVID, and then so we got on the phone. We were making phone calls till about 10 o'clock, and I think that was probably one of the best things we did was immediate. Keeping track of the attendance is huge, but calling our parents, and some of them got called twice, and some of them, you call them, they're like, yeah, I know, I got a text from somebody else or whatever. But just the reaching out, and nobody seemed to be very concerned. They said, okay, they're expecting it, and so they're sending their kids up here. It's a choice, and they're aware of the risks, and they're willing to take those risks on, and we're doing the best that we can to make sure that we're mitigating those risks while they're here. And so we've had a lot of support from our our families and the community, and we haven't had any issues since other than that. And so that's kind of our story from the summer.
Great, thank you. Andrew.
Well, I'd like to say that, we're doing something magical or great. I think a lot of it, we've just been really fortunate that the numbers in our community haven't been, real bad. We've been fortunate. We're kind of in a rural area like Lee is. I will tell you this, we've done a really good job. The coaching staff done a really good job of making sure how we track all of our athletes. We did not do a lot of the pods and keep them where they adhered to each individual cohort group, if you will. That had a lot to do with, a lot of our kids have to utilize different time slots because they need to help. They had to help their parents. They had to have jobs. But what we did is we had tracking sheets for each kid and each group. The way our weight room and our athletic facilities were set up, we did have to section those kids off into different areas. And so, there wasn't a whole lot of cross-contamination, I guess, between the groups that were actually on campus. And so they did, like I said, the coaching staff did a great job of creating all of our Google documents and all of our tracking methods that we had for that. Our school health officials were very helpful with that. And I'll tell you this, our community and our kids were a real big key to that with the communication. If they ever came in close contact or they were symptomatic, they were immediately talking to their coaches, their position coaches, their head coaches. They did a really good job. And like I said, I can't keep talking about like the coaching. They did a good job of pushing out all that information and continually talking to their parents and to their players. And that was part of the reason why I don't think we had a shutdown, is because when we did have a close contact outside at like a sand volleyball league that they were participating in, one of the instructors there had it. They immediately contacted the head volleyball coach. She contacted us, and we were able to communicate that and isolate those people or quarantine those people, immediately. Whenever we've had a parent that had a lab confirmed case and their child was there, we were able to go back and look and make sure that we quarantined that group of kids that they had possible close contact with. But again, it was a lot of the communication that happened that allowed us to not let it just kind of creep on for 5-6 days where they were contaminating or coming in close contact with large groups of kids. We had really good numbers starting out of the year. I think everybody was ready to get back and be around the kids their own age. But when we did have to quarantine, our numbers did drop. But like Lee was talking about earlier, we've been able to get back to normal. I mean, we've had quite a few kids. I can't tell you exactly the number of kids on campus, but we did shut down all of the strength and conditioning for everybody and went with just fall sports. That were the ones that were coming in next, where we were using the strength and conditioning time and the sport specific training. But we've had really good turnout. We mask everywhere we go. There are times that coaches are going to have to take their mask down, but they have to be 6 feet apart. And when you're addressing a large group of kids, like when we've had our sport specific training, you can't hear through the mask. So, coaches are being asked to stay 6 feet apart. And that's kind of what we've been working on and trying to iron out the details of when we're up here on campus with our kids about learning how to coach and then training our kids. Because a lot of it is, our kids want to be out here and they want to be a part of it. It's just getting them into the good habits of that. I know that Coach Lang had asked about the close contact proximity and things like that, about how you're addressing it in practice. What we had talked about as a staff is we're going to keep all of our practice plans. And we've gone through and kind of looked at when we can keep kids in groups isolated, when we're going to do the crossover type times. We're trying to limit those things. And then Pete had mentioned that they were talking about filming. We're gonna film large portions of practice, and to be able to show that we're not, our kids are socially distanced almost the entire time. We're not a huddle football team offensively, but when we do team, I've got the offensive line kids. They're gonna stay 2 yards off the ball and 6 feet apart. And when they get the call, they're gonna sprint to the line and get there. And then when they get the plays over, they're going back to their 6 feet apart. And we're going to show things like that to help with when they do start looking at contract tracing and they're starting to look at how we're practicing, being able to show those types of things, hopefully not have to quarantine a large group of kids where we would have to either forfeit a game or reschedule a game. So I don't know if that helps at all, but those are just some of the little things that we kind of came up with to try to figure out how we're going to make it through. Because right now that close contact definition, the 15 cumulative minutes, it's not if, it's when. And so if we can just show as many opportunities of where we're not doing that, or where we can limit the close contact, then I'm thinking that's going to help out. And only time we're not having masks on, coaches included, is, when they're actively participating, they're in the drill, or when they're in the shower, or eating or drinking. So I hope that helps, Mel.
Thank you, Andrew. So I know we're running long on time, guys. So what I want to do is open it up to Mike Clancy, Linhoff, Stan, Kelly, Bobby, Brenda, if you guys, Mike, if you guys have any announcements, anything you need to let us know about what's going on in your world, when you guys are starting, anything like that that's pertinent, floor is yours. I see Clancy's shaking his head.
Yeah. Well, I'll just mention for us, of course, and I shared our SMART playbook that we came up with, and in that is our district has developed a matrix, and just looking at percentages, and I won't get into it. You can look at it if you're interested, but based on those matrix, we're going to crank it back up this coming Monday. And basically it's going to look like a strength conditioning with pods as far as the ratio of kids and coaches. The following, it looks like everything now is going to lend us to get to that next level for September 8th, where we're going to actually start our team practices then. And just so some of y'all know, and I know I mentioned this to Kelly, and I got word from Brian Pope, we're technically starting, obviously strength conditioning back up again next week. For football, that we can start our acclimatization week that following week. And so that's going to be very beneficial for us. But in regards to starting back, that's the update for us.
Thank you.
I know one thing that we found out when we were having volleyball games at our 4A school that opened up. We had said, hey, in between, we're going to ask the parents to leave. And so some of the parents were waiting outside to buy their tickets, and we ended up in a lightning storm. And so we had to, we're trying to make sure, okay, we got to get people out of the main gym. So we ended up going into another gym and letting the parents go sit up in the stands. It wasn't a big crowd, so that was a good part. Letting them sit in the stands because they couldn't stand outside in the lightning. And then at that point, the football team came in, so we actually had a football team having to do what they needed to on the floor, but we had the parents, and it worked out good. The parents stayed in the stands away, and they were just waiting until the match was about to start. So, when you try to think of everything that what can I do, or plan A, B, and then here we had bad weather, and so you had to kind of, figure out a different way to either have a holding area or to tell parents where to go.
Great, thank you. Scott, Mike, anybody?
Well, same here. We're still rolling along, and I've been going all summer. We've just been very fortunate. Very, very few cases. I think we've had 3 students so far on the Clemens side. We've had 3 staff members. I don't know what they're doing at Steele High School, but they've been able to avoid it. And guys, kids are doing a great job, and they're showing up. They're wearing masks. Coaches are wearing masks. They're keeping distance. But when it comes to football, it's football practice without pads. And then we've told our kids, we recommend that they wear masks, but during periods of activity, they can take them off. And I go out there and watch, and there's a ton of kids going, and it's maybe a quarter out there wearing masks during actual drill work and team activities. And I think Coach Rohr's talked about, trying to distance and try to pod up during practices. And we did a really good job of that during strength conditioning. But since we've gotten back to more of just the sport specific stuff, it's looked a lot like what it normally looks like. So I don't know if that's a good or bad thing. Hopefully we can continue staying COVID free.
Great, thank you. Mike?
Jensen's the same way. District-wide, we, of course, shut down just like everybody, but we've been back for about 2 weeks now. We've had very few instances where we even suspected transmission. Those all checked out negative. So we've kind of dodged a bullet in all 3 of our schools. Like Scott's Shirts Clemens, our practices look very much like an unpadded football practice right now. Within the time limits, we transition from strength and conditioning back into what we normally do. And during that time, you see kids get more and more comfortable with wearing a mask, and some of them would not wear a mask. Some of them will bring out those buffs around their necks and wear those. But for the most part, like everybody's been saying, we believe that this has been very important for our programs, that the number of kids that are coming out and stating by their physical presence that they want to participate in athletics has been heartwarming and astounding. And the way that they've been cooperating with all the COVID guidelines and even taking responsibility for themselves has been really good. So we're just really encouraged, and we're going to start up just like everybody else on September 8th with our high schools.
Great. Suzette?
So out here in East Central America, we got to start back this past Monday, and the numbers were awesome. Our kids have done a really good job of following all of the policies and procedures. We only let the fall sports come back just so that we can minimize the amount of kids that we have on campus, because even though we're virtual right now, we did go ahead and bring back a majority of our special needs kids and kids that need some attention and special pops. So we do have some kids on campus. And so in order to eliminate any type of mixture, it's just fall sport kids on our campus right now, and that's going very well. I did want to mention, because we're probably the only district in the state of Texas that may be doing this, and that is out here at East Central, we are going to sit everyone 6 feet apart. We are not allowed to have pods. So you will not be able to sit next to your husband or your wife or a family of 4. Everybody's going to have to sit 6 feet apart. So my 7,000 seat stadium, when I go to give my visiting football team tickets, I got to take 100 tickets off the top, because we have our UIL passes and our comp tickets. So I'm only able to hand to Scott or Leanna or Mike 304 tickets for them to do with as they please for their football program, and how they want to divide that up. So volleyball, we've got 85 seats, so we will be clearing gyms, and so that's and also know we will not be taking any type of passes. Now, if you've got a gold card, I'm going to always reserve probably about 6 or 7 seats between the 2 schools. We're probably not going to get more than that on a gold card. I'll have a few seats that are saved for those, but we're not going to accept district passes. We're not going to accept our faculty passes. We're not doing student passes, and not because we don't want to. We just don't have the seating capacity, unfortunately, when you're using the 6-foot rule. If we're in pods, it'd be a different story, but our superintendent feels that it's our duty to make sure that we're protecting our community. And so he's made a decision in our school board that we will sit 6 feet apart, unless you have a child that can sit on your lap. But if you're a school age kid, they'd be sitting 6 feet apart. So if you have any questions, or you are someone that's going to be coming to play us here at East Central, give me a call. We are going to go to online ticketing, and we will also have someone at the gate. So I can save seats for anyone that you need. If you know somebody's going to come to scout at East Central, if you would, please make sure that they call the athletic office, or you as an AD, Kelly, when, at any point, well, Roosevelt, you're week 1, so never mind on that. But anybody else, just give us a call. We'll make sure that your scouts have a place to sit and go. But right now, we are going to stick to the 6 feet rule, and it's going to make it really difficult, but we'll get through it. I just wanted to make sure everybody knew that.
Suzette, if you could, I know when we first came on this meeting, you shared the flow chart for the contact tracing, or when you received a positive case. Can you share that with us? I mean, not now, obviously, because the time is running out. But
I'm just going to really quickly just to go through the. Yeah, I'll wait. What I'll do is I'll send it to Mel.
Okay.
So Mel and I were talking one day about it, and she said that they were working on something at Southwest, and so she sent me a copy of what they had created for their staff. And so all I did is I took it, my trainer and I, and didn't have to really invent the wheel, just kind of changed some things, but we did it towards student athletes and our coaches. And what I did is when you see it, it's a one pager, a front and a back, and it basically walks you right through the steps of what you need to do. I'm so tired of reading policy after policy that's 12 pages long. And so what I had all my coaches do is we snapped a picture of both sides of that one pager, which will walk you through the steps of what you need. They save it on their phone under favorites. And if something happens, they don't have to call me right away or the trainer. They have right there on their phone a quick guide as to what their next or first step should be, which has been very helpful. But yes, Mel will send that out to you guys.
Perfect. Thanks.
And on that note, I'm going to ask everybody. I know Stan has shared his plan, and Coach Miller at Marion has shared his. Suzanne has shared hers. I'm going to put those in a Google file and share that with everybody so you can upload your plans. Kelly, did you have anything to add?
No, not really. I mean, we're the same as East Central. We just started this past Monday with fall sports only. But like Mike said, the turnout was phenomenal. I mean, it was amazing how many kids have shown up, wearing the mask, doing everything like we did previously. You know, and like Stan said, because of this, we can do starting a helmet on the 8th, but we are probably, I've asked the coaches actually to use that week to put a helmet on the kids, but not count it as acclimation. Because I just don't know if they're going to be in shape enough, because we have not been able to work out with them every week during the summer. So, you know, I think they need at least 3 weeks before they start using acclimation period. And then, you know, like everybody else, you know, we're just trying not to have to quarantine everybody and trying to figure that out. The 15 minutes cumulative is kind of a killer, because I heard a couple of days ago from our health services it was consecutive. But apparently that's not right. And that's, you know, it's going to be a challenge. But, you know, if everybody else has been able to work out, especially you guys in Marion and all these places, have been able to do what you're doing and not have a lot of cases and have to shut down, it's going to give all of us a lot of hope. A lot of hope. So that's all I got.
Kelly, I can tell you that the CDC changed that guideline like 3 weeks ago. I learned.
Shame on them. Shame on them.
Yeah, it's going to change again. Don't worry.
Yeah. Well, I mean, I'm still trying to figure out 15 cumulative minutes. And she said 24 hours. Seriously. I mean, how in the world are we going to be able to do that? I mean, so it'll be interesting.
So I'm going to go ahead and I appreciate everybody. And again, I know we're long on time. I'm going to move to our committee reports real quick. I know Pete's got some stuff he's got to share from membership. Is Pete awake?
I'm not going to share my screen. I'm just going to say 2 things that came out of our committee meeting this morning. Number 1, membership invoices are going out on Monday for everybody who's a member. If you have a group membership, the biggest thing you need to know is if you're on one of those group memberships, that invoice is going to go to the athletic director of that group. So you'll get an email as to you need to renew, but the invoice is going to the AD. So ADs, if you have a group membership, there you go. And new members, that'll start going on Tuesday. And the big drive is to try to get the smaller schools and your athletic coordinators and things like that to continue to increase. We increased by over 1,000 people last year, and to try to continue that. Thanks.
Great, thank you. Barbara, do you have an update on TAC?
Not really. Just a reminder that we'll be resuming our sessions when we go back to conference on Wednesday, December 9th. Everything's scheduled to start then. The agendas should be put out pretty soon. I know they're working on that, and Bob can probably correct me if I'm wrong, but you guys can just go back to the Texas High School Coaches Association or athletic director website and just check and see what you need to finish and what classes you need to take still. That's all I have right now.
Great.
Barbara, is the conference, will that be also in a virtual platform format? Because I know that we will not be able to travel at all.
Sylvia, I think Bob's gonna.
Bob can probably speak to that.
Okay, perfect. Okay.
Athletic updates, Stan, Bobby? No. Okay. From the officials committee, I can tell you, Mike Bass sent this out, and I sent you guys an email, but within the UIL mitigation guidelines, in talking about positive tests, and I think they've learned this through the lower divisions that have been playing. If you have a positive test of one of your kids after a contest, you have to notify that school you played, and you have to notify the officials that officiated that game. So need to make sure that that plan's in place. I don't know if some of that was skipped. The other thing that I think that has come up was officials being able to have the authority to clear bleachers if fans were not wearing masks. And so I believe that that issue was cleared up with Mike Fitch at THSADA. So I think we'll be seeing something about that. Is there any other committee reports we need to share? Okay, great. I'm going to turn it over to Bob.
Thanks, Mel. I just have a couple of updates. Back to membership for a second. What Pete and I heard in our committee meeting earlier today is we've gone from a little over 900 members a year ago to just short of 1,200 members, even in these really uncertain times. So I think a reason for that probably is the attendance at our region meetings like today. You've got around 90 people that have been in and out of today's meeting. Our athletic trainer meeting, we had about 800 members, and athletic trainers attend that one too. So just the sharing of information that's taken place since March through now has been amazing. Willingness of people like yourselves on the panel to share your ideas and compare notes and be willing to grow together has been a great experience for me to witness, and probably very beneficial to you guys too. A couple comments on the officials. We're not sure if it's in your neck of the woods, but we are hearing in some parts of the state there are groups of officials that are opting out of calling games this year due to the virus. So I would encourage you, if you haven't already, to check with your local chapter to see if they're going to be able to fully staff your events at least this fall. And in addition to what Barbara said, the TAC videos are still available online from the last conference. We are working on adjusting plans for our in-person state conference, December 8th through the 11th. For those of you who may not be able to attend, we're going to work on some options for you guys also. But that is a work in progress. Will give us a little bit of time to digest that one. Couple of upcoming things for the association. We're going to have a THSADA webinar that's kind of a summary of what we've been talking about today from all 8 regions. That'll be in the upcoming week or 2. We're going to offer a second athletic training webinar probably in a couple of weeks when we get our athletic trainers where they can take time to take a breath a little bit, hopefully. That was so beneficial for what Scott Galloway did for us in his group a couple of weeks ago. And then we will have a THSADA fall roundtable the day after the Legislative Council in October. So look forward to those things. We also will have 7 or 8 region meetings for the month of September. It's likely that a lot of those will be carried to all 8 regions. And that way, if you want to listen in, even if it's not Region 8, you can feel free to do so. I really want to thank Melanie for organizing today's meeting, and all of you on the panel, and then all of you who listened in and added the questions that we got to share, especially to the doctors that visited with us today. Their insight and their professionalism is greatly appreciated. I'd encourage all of you to share your mitigation plans with Mel, and then she can share them out with your group, but also please send them to me or Rusty, and we will post on our website. There already are several up there for you guys to look at, but we can add yours to it and have a great body of information to share with our folks. So that's really all that I have today. Thank you all for being here. Mel, I'm sure you've got some closing comments to make, and then Mel, I'd like you to stay on the call when we end the meeting today, just for a few minutes.
Mel, you're muted.
I'm asleep. Sorry. I just want to thank everybody, and I appreciate your time. I know this meeting went kind of long, but I think there was a lot of good information shared. If you guys have questions or want to send me information to send out, let me know. If you're requesting information from others, I'll send that out to the region as well. Stan, just double checking, no High School Coaches Association updates?
Just real quick, and they just announced they're going to have an overtime coaches clinic for coaches, and you guys can get the information on the Texas High School Coaches Association website. September 19th will be a winter and spring sports that they'll cover, one day's coaches clinic. And then on December 19th will be for fall sports. And, you know, obviously we spent all the time today for obvious reasons talking about what we had to talk about, but I think we need to continue to encourage our coaches on the professional development side. You know, obviously it's probably good mental health, you know, to get their mind off of all this. Obviously we've got to pay attention to this, but to encourage them to be a part of that would be great. Thanks, Mel.
Thanks, Dan. Guys, go have a great day. I appreciate your time. If you need anything, let me know. Okay.